This is the C-Day presentation for the topic of understanding the drivers of medication non-adherence in the United States. Project summary. This project is about understanding the drivers of medication non-adherence in the United States. We have delved into multiple sources such as the NHIS, CDC, NCBI, and many other sources to understand the different areas of medication non-adherence. Final deliverables will be an extensive research paper depicting each factor of non-adherence and data charts showing and comparing levels of non-adherence of various topics. Our topic questions include: what variables are the most relevant drivers of non-adherence? Does the direction and strength of the associations between these variables and medication non-adherence vary over time? If so, how? Are trends getting better or worse? Do the results of your analysis suggest that social inequality factors may be linked to medication non-adherence? If so, how? What are the implications of your analysis for various stakeholders? How does this vary depending on whether medication non-adherence is intentional or unintentional? Time frame and reasoning behind it. Our selected research time frame was during the years of 2013 through 2016. The selected time frame was chosen due to the Affordable Health Care Acts and also because of standardized and consistent results. For our first topic question, we are talking about what variables are the most relevant drivers of non-adherence. Most relevant variables that drive medication non-adherence falls under one of the below categories according to the various CDC, NHIS, and NCBI studies. These variables are socioeconomic condition of the patient, healthcare system of the country, medical condition of the patient, treatment and therapy of the patient, and variables related to the patient themselves. Another topic question we include is: does the direction and strength of the associations between these variable and medication non-adherence vary over time? If so, how? Overall evaluation of the strength level of common variables that impact the medication non-adherence. Education versus poverty is also very key, and importance of laws and acts that help against medication non-adherence. Here are some graphs depicting each of these variables of this particular section. Are these variables gaining strength over time? Why? Percentages change over time, influence of the political controlling party, differences in percentage changes depending on the ends of the various spectrums, and influence of government acts and medication non-adherence, and strength of poverty and education level. Another topic question includes: are trends getting better or worse? Medication non-adherence trends are in fact getting better. They have a consistent steady decline from the years of 2013 through 2016, as depicted in this graph. Here are some trends. These trends are organized by several categories, whether it be sex, family income, poverty status, health status, and insurance coverage. Here are some graphs that are depicting each of these subtopic questions. As you can tell, each of these graphs are continuously degrading or decreasing over time. There are a few outliers, such as the percentages of people whose current health status was good. However, for the most part, all of these graphs have a steady decline of medication non-adherence over time from the course of 2013 through 2016. Another topic question includes: do the results of your analysis suggest that social inequality factors may be linked to medication non-adherence? If so, how? Family income appears to be a significant performer. Strong correlation between each income bracket. Insurance coverage, second leading factor according to the data, and higher education. Little to no correlation to medication non-adherence. Here are some other graphs depicting each of these subtopic questions. Our final topic question is including: what are the implications of your analysis for various stakeholders? Does this vary depending on whether medication non-adherence is intentional or unintentional? Insurance payer. Earning the highest star ratings for possible Medicare Advantage plans makes insurance take medication non-adherence seriously. Medication non-adherence places a significant cost burden on healthcare systems, thus by payers having to refund providers and patients. Pharmacy. Pharmacy is also one of the stakeholders that is affected by medication non-adherence. Low sale orders could also mean the supply chain is getting hit and manufacturers and brokers are canceling a specific pharmacy from their network. Non-adherence also leads to the loss of reputation for pharmacy broker and markers. Here are some graphs depicting each of these percentages. Here is also our Gantt chart showing all of our total man hours for our project. Thank you for attending this C-Day presentation on understanding the drivers of medication non-adherence in the United States. This concludes this presentation.